Assessment of the fat pads around the knee on the MRI is an important thing to do, and you specifically need to look at them. So we have three fat pads. We've got the suprapatellar or quadriceps fat pad, we've got the supratrochlear fat pad, and then we have the infrapatellar fat pad. So today we're going to look at the quadriceps fat pad or suprapatellar fat pad. And the findings that you see of impingement are the same here as you will see in the other fat pads. So if you learn it in here, then you can apply it to every other fat pad. So first of all, let's start with what's normal. And the normal suprapatellar or quadriceps fat pad is a triangular structure. So it's outlined here in the orange line, which lies behind the quadriceps tendon. And normally what you'll see fluid at its posterior margin, which is the suprapatellar bursa. Important things here is that this is filled with fat, so it should be high signal on PD, and on the PD fat side, it should saturate. You will see some little bits of high signal, which are vessels, but you can use an internal reference, which is the supratrochlear fat pad, and if it's saturating or it's the same sort of signal, similar signal and reduced in signal, then it's normal. The other thing that's important is to look at the posterior margin. So the posterior margin of this quadriceps fat pad should be either flat or concave, and we'll see why that is in a moment. And when we look at abnormal findings, so if we look at impingement, what we have here is we have increased signal within that suprapatellar or quadriceps fat pad. If you compare that with the supratrochlear fat pad, you can see that this is saturated completely and it's very dark, it's quite bright. And the other thing is to look at the posterior margin. And this is less common to see the sort of bulging of the posterior margin, convexity. And that's because there's lots of edema in here, it's just pushing it out. You can also get some impingement of the anterior margin of the supratrochlear fat pad, which we're seeing here. But again, that's not as common. It's just simply seeing increased signal within it. Same imaging findings when we're looking at the supratrochlear or the infrapatellar fat pads. We're looking for increased signal on the PD fat saturated sequence. So how would you report this? Very straightforward. You just say that there's increased signal in the quadriceps or suprapatellar fat pad, together in this case with expansion of the posterior margin and convexity. And there's also some indentation of the anterior margin of the supratrochlear fat pad in keeping with impingement. If you're interested in learning more about knee MRI, we have a specific guided online knee MRI mini fellowship where we take you through and teach you how to assess a knee MRI scan and find the normal structures, look for the abnormalities, and then how to actually report them so that you become much more confident in reporting. Or you can join our WhatsApp community. We put out a fair bit of educational information on this, very quick and easy things to learn. And we also have a number of other courses with all the other joints and spine. And at the moment we have 9, but that will be increasing fairly soon.